Welcome to Dr. Durden's Straight Talk on Health and Wellness. This is our first show and we're really excited to be here. I'm Dr. Durden and this is my co-host Deborah Woodard. And Deborah, how are you today?
I'm great. Thanks for having me. I'm really excited to be here to talk to you about health and wellness. Now, I understand that this is not your first career.
Well, that's right, Deborah. I was an educator before I was a chiropractor, and since we educate our patients, I'm still an educator.
Okay.
But I started out as a math teacher, a high school math teacher.
Wow.
And this has been, I've been very blessed to have really 3 wonderful careers. My experience with high school kids brought me to individualized instruction with math, and I then got a master's degree in counseling and went on to develop individualized programs for these kids, which really helped them to succeed. Now, I never said I wanted to be I always said I wanted to be I always said I never wanted to be an administrator.
Okay.
We may have to take this one again. But I did do that, and eventually I decided that I wanted to get back to working with people. So I considered a couple of things, and chiropractic was one of them. And here I am today, many years later.
That's such a big switch from education to being a chiropractor. So what led you to chiropractic care in the first place?
Well, I had developed sciatic pain, and a friend of mine said, why don't you go to my chiropractor? Now, I'd known about chiropractic, but had never been a patient before, and I had great success. This doctor was wonderful. He worked on my back, and my back got better, and later I had some problems with headaches and trigeminal neuralgia, and that got better, and I just stayed under care for a period of time and just really got feeling great. So when I decided to change careers, this definitely was something I considered. I thought if I could help other people the way I'd been helped, that it would really be a rewarding thing to do.
Wow, that's great. It's got to be a wonderful thing to actually love what you do. So you saw a chiropractor because you had some health issues, and then you actually pursued a career in chiropractic care. Now, I understand that the technique that you use is quite unique. Could you tell us a little bit about that?
Yes, well, the technique that we use in our clinic is called Atlas orthogonal technique. Now, that's a mouthful.
It is.
But I'll explain what we do. The top bone in the neck is the atlas bone, and that really holds up the weight of the head. The head weighs 11 to 17 pounds, so it's got a big job. But when it is balanced, our whole structure is balanced. And when it's not balanced, it can affect lots of health issues. So our job becomes evaluating that and setting that in place. Orthogonal means balanced or at 90 degrees. And we do that with an instrument which is very gentle and very specific. So here I am now doing individualized adjustments on patients like I did the individualized instruction with the kids. So it's not that different, actually.
Talk about full circle. So is this the instrument? Can we take a look at that instrument you're using?
Yes, yes, this is it.
Wow, that looks a little scary.
Oh, Deborah, it does not hurt. The technology actually allows us to impart a force, a percussive force, which is like a sound wave. And we don't feel sound waves, and you don't feel the percussive force of this instrument. So we ask people to come in for a free consultation so that they can actually check out the technology, which has really brought me to even a higher level of well-being. You know, I'm going to have my 64th birthday soon, and I'm feeling great.
Awesome. That's great. Well, you know, I think I may be interested in telling some of my friends about that free consultation, because if you say this instrument doesn't hurt and it's gentle and you've had such great success, I'm really interested in telling my friends about it.
Well, you know, a lot of people are afraid of chiropractic because they think that they have to get their necks popped and cracked. And that is absolutely not true. This is precision tuning of the neck, and it's very gentle, and people don't even feel it. So yes, send your friends over. I'd love to meet them.
Very good. I've enjoyed this.
Okay. Well, Deborah, I'm real excited about the series that we're doing, and we are going to introduce other things about health and wellness, other than chiropractic, though we will still be looking at some other health-related, spine-related topics. And our next guest, who is going to come in after the break, is Robin Martin, and she is going to join us to tell us, she's a wonderful massage therapist, and she's going to tell us about that wonderful technique. So join us. Did you know it's possible for a chiropractor to align your spine with no popping and cracking? It is.
I come to Dr. Durden because she has a scientific, customized solution that fits just me.
I came to Dr. Durden just to get rid of pain. I had no idea I'd be playing golf again.
Dr. Durden's holistic approach has given me relief from my C5-C6 fusion pain.
Every time I come to Dr. Durden's, I leave here feeling like a spring chicken.
I'm Dr. Durden, and we're here to help you get better. Welcome back to Dr. Durden's Straight Talk on Health and Wellness. We're here with our special guest, Robin Martin, who is a massage therapist. Welcome, Robin.
Thank you, Dr. Durden.
And why don't you tell us a little bit about what brought you to massage therapy?
Okay, I love to answer that question. When I was young, I had a car accident. I didn't think I was hurt, but within a few days I did develop symptoms, and I went to the doctor. They wanted to perform a very scary procedure called a myelogram, where dye is injected into the spinal fluid. That sounded frightening, so I opted for door number 2. Therefore, we had physical therapy and drug therapy for about 9 months to no avail, and I wasn't able to hold a job at all. So back to the doctor, and had the myelogram run. It was inconclusive. It was the CAT scan that showed the problem. There was a disc in my neck pressing on the spinal cord, causing my symptoms. That wouldn't fix itself, so I did have surgery. They went in the front of my neck. They took out the damaged disc pieces, took a piece of bone from my hip, shaped it like a little mock disc, and placed it in between the 2 vertebrae, sewed me up in a war collar for 6 weeks, and they fused. But as I healed, I realized I had back pain. And it's sort of like the squeaky wheel gets the grease. But my neck was fixed, if you will, but I was still having pain. So I opted to try chiropractic care, which I had not done before. When she showed me the x-rays, the chiropractor said, "I'm confident I can help you, but I'd like for you to have massage therapy along with your chiropractic care." And she said, "You know, your muscles are anchored onto your bones, and when they're tight, they actually pull the bones out of place. And when you consider that the spine is nothing but a series of joints, you know, even I realized, wow, that makes sense." So I agreed, and after just a few weeks of both chiropractic and massage together, I was completely pain-free and absolutely amazed, and said, "I've got to be part of this world, this natural healing." And so this September will be 20 years as a professional therapist.
Wow. So, Robin, you've seen a lot of folks over the years who have all kinds of different problems, I'm sure. So why would someone choose massage therapy for themselves?
Well, there are very many things that can lead someone to choose massage. Since it is all natural and there are no ill side effects, it's a form of therapy that many people can use for stress relief. For people who have some physical afflictions, a lot of repetitive motion injuries, you know, like just tennis elbow. A lot of people have shoulder issues. Anybody who is seeking pain relief and does not want to go with drugs, and you know, the medications and their side effects can be just as bad, if not worse, than the original problem. There are also some medical conditions such as diabetes that people who are diabetic benefit tremendously because of the tremendous increase in the blood circulation and lymphatic function. Fibromyalgia patients also respond very well to massage therapy.
Are there any limits to people who maybe should not? Are there any contraindications to having a massage? Are there any people who can't get one?
I'd love to say that everyone could receive a professional massage, but unfortunately there are some restrictions. Individuals who have a history of blood clots, they are not good candidates for massage. It is just too dangerous for them. There are certain conditions, extreme varicose veins. No, you don't want to do that. Those vein walls are thin, prone to tearing, and also, again, possibly some clots behind those valves that aren't functioning that you could set loose. So those kinds of conditions, not good. Women who have not cleared their first trimester in pregnancy need to wait until they have before they receive massage.
Mm-hmm. Okay, and we get a number of people who have had trauma, and we check them out and then we refer them for massage because it's a wonderful complement to what we do. Now tell me, Robin, when someone wants to come for massage, what is their role in this? Because some people think that it's just a feel-good thing. What you do really is a very therapeutic massage. So how do people have to come? What role do they play in this experience? Because it's not a one-way street.
It really is not a one-way street, and I'm glad that you asked about that. Individuals who are seeking massage therapy need to realize they have a responsibility before, during, and after their massage. When they finish with their massage, they are responsible for having adequate water to help flush their system. Mm-hmm. Prior to coming to the massage, they need to be well hydrated as well. This is a massage is really a detoxifying experience, and so the water is necessary for flushing out of the body what we have milked from the muscle tissue. Mm-hmm. So that's very important. During a massage, this is very important. Whether someone is seeking massage for relaxation or if they have some physical ailment that they want to have addressed structurally, they need to come with a mindset that they're ready to work and do their part. Mm-hmm. Even if it's relaxation, that means plan your schedule so that when you finally do get to have your massage, mm-hmm. that you don't have to do anything that is going to cause you additional stress or put demands on you. It needs to be at the end of your day so that you can actually relax and get a good night's rest.
Robin, thank you so much for coming to our first episode and sharing that information. And thank you for watching. I'm Dr. Durden. Until next time, stay healthy.